Diri, guro ka kailan mag-anak ko. Diri, oh.
Dari po. Mutuyok mo sa phone niya. So, first is, after that is we need to identify the patient by asking his name, age, and birthday. So, may I know your name, sir?
Jumari, ma'am.
Your age
21,
and birthday.
July 12, 2004.
Thank you, sir. So, after that is we need to verify the patient by his name band. So, after identifying the patient, is we need to perform our equipments and perform hand hygiene and put on gloves. So we have the alcohol right here. This will help eliminate any pathogens and prevent cross-contamination. And after that is we need to put on gloves. So after putting on gloves is firstly is we need to do the assessment for the general appearance. So first is we need to assess the appearance of the patient if there is any distress. This will indicate if the patient has any pain that he's experiencing, and then after assessing the appearance is we need to know the level of consciousness by asking kung katuod ba siya, kung asa siya karon, and kung unsa ang oras. And then after that is we need also to inspect the posture and gait of the patient. So we can clearly see that the patient posture and gait are normal. And then after that is we need to do the vital signs. Asa ka ni? Kaya ako rin batang And then after performing the vital signs is we need to move for the head and the face assessment. So firstly is we need to inspect for the hair of the patient if the distribution of the hair are even, and also to know if the patient hair is thick or thin, and also in order for us to clearly see if there's any lumps or lesions. And then after the hair is we need to also assess for the face in order for us to see if the face is asymmetry or asymmetrical. Thank you so much, sir. So after that is we need to move for the eyes. So we need to we need to inspect for the conjunctiva and the sclera. So we need to inspect and palpate. So the eyes are normal. It is pinkish, and then after that is we need to also assess for the pupils. So let's just assume that I have the pen light right here, and if the eyeball is inward, which it means that the patient has esotropia, and when the eyeball is outward, it means that the patient has exotropia. And then after that after assessing the pupil, is we need to move for the ears. So we need to inspect the external ear. So this is the ovule, the auricle, this right here. So we need to inspect first, and also the lobule and the tragus. This would be the tragus. This will assess us if the patient has any lesions or any lumps. And then after that is we need to palpate. This will ensure that the patient, we can assess that the patient has been experiencing any pain. So we need to ask the patient once we palpate the ears. So sir, nga ba kayo na-feel nga pain, sir?
No, ma'am.
Thank you so much. Sir, how about this side, sir?
No.
So after that is we also need to assess for the hearing of the patient in order for us to know if the patient has any hearing impairment. So since we don't have any tuning fork, so let's just assume that I have a tuning fork right here. So let's just assume that this is the tuning fork. So first, we need to do the whisper test. So we need to stand behind the patient for about 1 to 2 feet. And then we need to whisper 2 syllables for the patient. So na kumadong ganin. Wonderful. Ganin mo?
Yes, ma'am. Wonderful.
So, since the patient can clearly hear the words that we are saying, so it is normal. And then after that is we need to do the rhyme test. So, we need this tuning fork, and then we should note for the time that the patient hears the vibration of the tuning fork. Adong ganin mo, sir?
Yes, ma'am.
So, also we need to compare if which ear can the patient clearly hear the sound of the tuning fork. And then after that is we need to do the rhyme test. So we also need the tuning fork. Lunggan, sir.
Yes, ma'am.
How about this side, sir?
Yes, ma'am.
So after that, after the ears is we need to move for the nose and cyanosis. So first is we need to inspect for the nasal So can you lift your head, sir? So let's just assume that I have the pen lighter here to clearly visualize the internal structure of the nose. So everything is normal. There's no drainage. Then then after that is we need to palpate for the cyanosis and also percuss. So there is no any lumps or lesions. So after that is we need to move for the mouth and the throat. So first is we need to assess the lips, gums, and the tongue. So can you open your mouth, sir? And also inspect for any tonsils and for the ovula. So when you see ovula, muna siya ang kanang tilaon. So that we can see if kanang nabay any tonsils and any odor of the patient's mouth. Thank you so much, sir. So after that is we need to move for the neck. So first is we need to palpate for any lymph nodes. And before that is we need to ask for the consent of the patient to prevent any discomfort. So sir, ako palpate imong neck, sir, ha? And there's no any lump, sir. Then after that is we also need to assess the trachea of the patient and also palpate for any thyroid and the verbalization acceptable. So we need to palpate. everything is normal. So after that is we need to move for the breast and the axillary assessment, and we need to inspect and also do the verbalization. So let's just assume that the patient's chest are exposed, but make sure to provide privacy to to prevent any discomfort, and so that the patient can feel comfortable. So we need to inspect for the color and the consistency of the patient, and also ask the patient if there's any surgery before this assessment. So sir, ba ay nag-surgery ba ka before aning assessment, sir? So wala. So again, we need to inspect for the breast of the patient. Can you lift your hand, sir? So we need also to assess for the axillary to know if there's any lesions or any masses. So everything's normal. So can you move to the other side, sir? Thank you so much, sir. So after that is we need to do the for the respiratory system. So we need to inspect the chest. Make sure that the patient won't know that we are getting the pulse of the patient, so that it will not alter the pulse of the patient. So firstly is we need to auscultate for the lung sound. So we need to follow the sixth position. So we need to use the diaphragm, and then later on we are going also going to use the bell, so that we can hear the murmur sounds. Take a deep breath, sir. Exhale.
Murag nindot ilang dagan karon sa opisina.
Exhale. Inhale.
Murag nindot ilang dagan
Exhale.
karon sa opisina.
Inhale. Exhale. Inhale. Exhale. Thank you so much, sir. So after that is we need to inspect for the chest of the patient. So again, we need to ensure the patient's privacy. So let's just assume that the patient has a gown. We need to inspect for the chest in order for us to know if there's any lesion. Thank you so much, sir. So moving on with the cardiovascular. So first is we need to assess for the apical pulse. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. So everything is normal. We can hear the S sounds. So moving on is we need also to auscultate for the heart sound. So after that is we need to, we can hear the patient's sound, so everything is normal. The patient's heart sound is not wheezing or crackle, so everything is good. And then next is for the abdomen. So of course we are going to follow the the inspection, auscultation, palpation, and then the percussion. The percussion is not included. So first is we need again to expose the abdomen part of the patient so that we can inspect for its consistency, the color, or any lesions or masses that has been built up. So sir, I'm going to inspect your abdomen, sir. Would that be okay?
So,
So after inspecting, is we also need to auscultate for the abdomen. And by the way, for the auscultation is we need to wait for one full minute. So again, I'm going to repeat for the heart sound. So the patient's heart sound is 78, so it is normal. Since the normal pulse is, heartbeat is 60 to 100. So same, we also need to do the same technique for the abdomen. So everything is normal. So moving on with the palpation. So this will assess if the patient is experiencing any pain. So we need to ask the patient for the pain level, which is we need to use the scale from 1 to 10. 1 is the lowest and then 10 is the highest. So sir, I'm going to palpate your abdomen, sir, ha? Pag-ingat lang, sir, if naay any pain nga imong ma-feel. Yes, sir. Yeah. So everything is normal since the patient doesn't experience any pain. So after that is we need to do the musculoskeletal system. So first is we need to do the range of motion. So sir, can you lift your head, sir? Down, sideward, side. And can you do this, sir?
Naaragod kung gidayon pa ni Biyot, kila iyan hanggang si. Matrumil pa
Pangusog, sir, ha? Pangusog. Yan ang bata kong mirahin. Dapat. So, the patient's range of motion is 5/5, and we also need for the lower extremities. So 5/5, everything is normal, and then after that is we need to do the neurological screening. So this will assess the orientation of the patient, the place, and the time. So sir, kabalo ba ka, sir, kung asa ka karon, sir?
yes ma'am.
Asa man ta karon, sir? Hospital.
Hospital.
So thank you so much, sir. So can you Kabalo ba ka, sir? Kung unsa na oras karon, sir?
Yes, ma'am.
Sa unsa man tang date karon, sir?
March 31.
What day, sir?
Day?
Tuesday.
Tuesday.
Balik. Ikatra na ako na.
Isa, ang ako yung date karon pati ang oras, karon gid nga oras.
Ayun na, ang oras, ang letra. Hindi, balik.
Kaya
Wa-
ito Tuesday.
Tuesday ganit. The day, sir?
Tuesday, ma'am.
Thank you so much, sir. So after the neurological screening is we need to do the simple coordination test. So sir, can you tindog, sir? So we need to do the Romberg test in order for us to know if the patient can assess himself kanang by kanang dili siya matumba. This will assess if the patient can balance his or his self. So sir, can you stand, sir? And then cross ang feet. And then sideward. And then close your eyes. Dili tikawin na para in order for me to know if you can assess yourself or kung dili baka matumba, sir, for 1 minute.
Ano?
So thank you so much, sir. So can you can sit now? And then since the patient doesn't experience any swaying, so everything is normal. So after the head to toe assessment is, of course, we need to document. This will provide a legal record and also establish a future comparison for this assessment. And then next is we need to remove the PPE and perform hand hygiene. So I'm going to use the alcohol. And then observe the infection control. So we need to do the aftercare. So that would be all, sir. Thank you so much, sir. So that would be all, sir. Thank you.